Taoiseach, there's a chronic shortage of public health nurses in Tallaght and across the South Dublin County Council area. Babies are going without routine developmental checks that are vital for spotting issues early on and referring to appropriate services. Home-based catheterisation is another essential service that has been removed, forcing very ill patients to travel to clinics to access it. The HSE has said that it's trying to recruit more public health nurses, but there's not enough applicants to fill the vacancies. Once again, the housing crisis is at the root of the problem. Thousands of nurses are emigrating every year because they cannot afford to rent and cannot access social or affordable housing. This is on top of the low pay and poor working conditions for nurses, also caused by understaffing, driving qualified nurses to leave the country. Taoiseach, what action are you going to take to ensure that we deal with the vacancies in public health nurses?
Deputy Murphy raised the issue of the chronic shortage of public health nurses. And again, it would make the point, he said, oh, the nurses are leaving the country and so on. But the bottom line is that about 28,567 extra staff were recruited into our health service since the beginning of 2020. That's a 24% increase over the last 5 years, or 4.5 years. About 10,000 of that were nurses and midwives. And according to the OECD, Ireland has the second highest number of practicing nurses per capita of any country in the European Union. I acknowledge there's a specific issue in relation to public health nursing, and the HSE is working in terms of recruitment for public health nurses who do provide a vital link in terms of identification of issues, particularly among newborns and children in their earliest months and years, and that's particularly important. But we should not forget the bottom line is that we have recruited more nurses than anybody in Europe or within the OECD in recent times and continue to do so.